So it doesn't mean that the organ, like the bladder, for example, is actually poking through the vagina. It means that it's pressing into the vaginal wall and it's shifted and it's causing a feeling of pressure and heaviness.
Today, I'm speaking with Dr. Brianne Grogan, better known as Dr. Bree, who is the founder of FemFusion Fitness, which is a great resource of accessible information on pelvic health and exercise. And we have a lot of questions from our community to ask you. But first, I just wanted to thank you for sharing your expertise with us.
Oh, thank you. I'm really happy to do this. So let's dive in.
Awesome. Well, first of all, maybe you can tell us a little bit more about your own story and how you came to specialize in pelvic fitness.
Oh, yeah, absolutely. So I was interested in pelvic floor physical therapy in PT school when I was studying to be a doctor of physical therapy. But I actually went into a different field at first. I went into geriatric physical therapy, but I decided it wasn't quite for me. And then I got pregnant with my son, and I ended up developing my own pelvic health issues as I was really kind of diving into the field of pelvic floor physical therapy because I wanted to transition career or field within physical therapy. So I was studying for the transition to pelvic floor physical therapy, and then I developed my own prolapse.
Mhm.
And I thought, okay, now I now I understand even better from a firsthand perspective about what my patients are going through. And so it was really from there that I just fell in love with it and fell in love with the women who would come in, and men as well, who would come in with pelvic floor issues and say to me, I had no idea that first of all this was even a thing, and
Mhm.
secondly that there was help for this. So I mean it was incredibly gratifying. So that's the nutshell version, I guess. And
Yeah, it's amazing.
yeah, and pelvic floor fitness, I can kind of go in a little more to the more fitnessy side briefly, in that I actually developed my brand, if you will, FemFusion Fitness, and my company in a fitness class. So I created a group fitness class when I was back in Oregon, where I'm from, Oregon in the United States.
Mhm.
I don't currently live there anymore. But when I was there, I created a group fitness class called FemFusion Fitness, which was all about a fun fitness class that would make people want to come. We incorporated dance and all sorts of movement to get your heart rate up and really feel great. But the whole thing was about the pelvic floor the whole time. And so it was this sneaky way of getting people to work their pelvic floor and their core without really realizing it. So I'm a huge fan of fitness and global pelvic health. So
Yeah, it's great. I've actually been doing one of your programs the last couple of weeks. So you're basically the first person I see each morning.
yay! So cool.
Yeah, it is cool. And it is fun too, which is something that I like about it a lot. I think it would be helpful if we start with some anatomy first. So perhaps you can explain the muscles that do make up the pelvic floor and how the bladder is supported in that space.
Okay, yeah. I have models because that's just the best way to really look at this.
Right.
I have several different that I can share. And men and women do have a pelvic floor, of course. But this is showing a female pelvic floor, this model right here. This is kind of cool because it shows the organs that are inside. So
Mhm.
I'm going to take them out, but we have the bladder, the uterus for females. Of course, men don't have this, and then the rectum in the back. So
Mhm.
I'm going to go ahead and take these out. There's a lot going on in this pelvic bowl. Because then on top of that, we have all of the intestines, the guts, if you will. So there's a lot going on inside. But then the muscles themselves, you can see deep in here. This would be the inside view of the pelvic floor. And here would be the outside view of the pelvic floor.
Mhm.
So this would be, for example, somebody lying on their back for a vaginal exam. And there's an outer layer of real small, tiny pelvic floor muscles that surround the urethra and the vagina in women, and then the anus as well in men and women. So I'm going to take off this layer of more superficial outer pelvic floor
Mhm.
muscles. So there they go. And here's the deeper level right here. So this is, we can get really complicated about it, but I think we should just keep it simple
Mhm.
and call it the outer layer and the inner layer. And the inner layer is pretty broad. It's pretty deep. It's pretty significant here. It's called the levator ani collectively. And one way you can think of this is if you think of doing a Kegel exercise, you can think of it as a squeeze and a lift and then a
Mhm.
relax. And these outer muscles are more of the squeeze, and the deep inner muscles are more of the lift.
Okay.
So that is what we have going on here. And they span like a hammock. They help support the pelvic organs. They're not like, one interesting thing to know is that the pelvis is actually situated tilted slightly in the body. So it's not actually situated like this where the hammock is down on the bottom. The hammock is kind of tilted like this, just
Mm-hmm.
so people have a reference point, but it is a hammock that supports the organs, helps provide stability and control for your core, because these muscles are part of the entire team of core muscles. They really feed into the abdominals, the deep back muscles, the hip muscles, and the breathing diaphragm at the top. And they all need to work together to help provide you balance, support, and stability. And then, of course, the other things that they do is they help to offer control of your bladder and your bowel.
Mm-hmm.
They kind of keep things in and they let things out. They open and close to allow for poop and pee and sexual intercourse and babies and all of that.
Okay.
So does that, and then I have another model too. I'm not sure if you, well, maybe we'll get to it later, but I have another way.
Don't reveal everything straight
We'll
away.
stop there, exactly.
Well, so when it comes to the pelvic floor, then can you explain what it means to have pelvic floor dysfunction?
Yeah. Oh, yeah. So pelvic floor dysfunction is, or oftentimes called CPPS, chronic pelvic pain syndrome. That's another term that's often used.
Mm-hmm.
But I think pelvic floor dysfunction is a big umbrella term that covers a lot of things. I mean, basically, it's something is going wrong with your
Mm-hmm.
pelvic floor muscles, and oftentimes that may be, oftentimes it's weakness. But weakness doesn't always mean that the muscles are sort of like loose and saggy. It can very often mean the muscles are overly tense and tight.
Mm-hmm.
And so they're not working well, they're uncoordinated. It can cause issues such as bladder issues, bowel issues, sexual health issues, and definitely pain. So again, it's an umbrella term. It can be all sorts of things.
Okay. Is it important to see someone like yourself or a pelvic health specialist to be able to differentiate what is actually happening there?
Yes. I mean, if at all possible, I highly recommend somebody see in person somebody. I actually don't treat people in person anymore. I'm just online. So I always recommend, if possible, it's unfortunately a pelvic floor physical therapist is still a somewhat uncommon field. And when there is one in your area, they might be full. But if you can find somebody in your area who you can see in person, that really is ideal, because they can give you an examination.
Mm-hmm.
And that's my other model here, is showing you how they can actually feel your muscles and help you understand what's going on. If the issue is more with coordination, if it's with tension, if there's trigger points, if you have prolapse, if you have whatever.
Mm-hmm. You just mentioned prolapse, which was my next question. And what types of prolapse are there? And maybe just a bit of an explanation about what prolapse is, because I think for some people, and in my own case potentially too, after surgery, like excision surgery, it's maybe more of a shift rather than a prolapse. And that can be kind of confusing about what's going on there. So an explanation would be great.
For sure. So a prolapse is I actually like to call it a pelvic organ shift, because to me, that's a little bit less scary sounding than the way a lot of people describe it, which is descent or a falling of the one or more of the pelvic organs. But basically it is, something has shifted. One of the organs has shifted. The organs are surrounded and suspended by fascia, the connective tissue that kind of keeps everything in place. They're surrounded by ligaments and fascia, and they're surrounded and suspended in that pelvic bowl. But what can happen is, in females, the vagina is in the middle, and the bladder, so this is our vagina right here. The bottom of the uterus is the cervix, and then we have our vagina. The bladder can essentially descend or shift and press into the front vaginal wall. So I don't know how clear this is here, but the bladder can shift and press into the front vaginal wall. This can get a little weak. And sometimes if there's, if they can refer to it as like a thinning or a softening of the vaginal wall. And that can happen with a bladder prolapse, which is called a cystocele, or it can happen with a rectal prolapse too, where the rectum kind of shifts into the posterior vaginal wall. So it's pressing into it. So it doesn't mean that the organ, like the bladder, for example, is actually poking through the vagina. It means that it's pressing into the vaginal wall and it's shifted and it's causing a feeling of pressure and heaviness. And then
Mhm.
the uterus can also prolapse as well, which is when the uterus maybe descends into the vagina. Um, there can also
Okay.
be something called a vaginal vault prolapse, which is if you've had a hysterectomy, the uterus is gone and the top of the vagina
Mhm.
descends. So
Okay. One of the specific questions we got was about the comment of having a thin wall between the vagina and the back passage. So that sounds like what you just described, which is actually a type of prolapse.
yes,
And
it's usually
just
referring to a rectocele in that case.
okay.
And the thinning is because often of kind of a thinning of the tissues, which tissues do change as we get
Mhm.
older. It can also be from a weakening of the tissues from overstraining, like repetitively straining to have
Mhm.
a bowel movement. Childbirth can definitely, be a
Yeah.
challenge in the pelvic floor, things like that.
Are there exercises that can help with that, or is that something that you need to look at surgery for?
Oh, wow. No, I mean, in some cases, yes, surgery is the best option, but definitely the first step for prolapse, I always tell everyone, please, please, especially if it's a mild to moderate prolapse and not severe where the organ is actually the bulge is actually showing outside of the
Mhm.
vagina. If that's the case, then oftentimes surgery is needed to get things
Okay.
back. But if it's mild to moderate, where the bulge is still inside or just even at the level of the vagina, there's a lot that can be done. People can use, first of all, something called a pessary,
Mhm.
which is a device that kind of holds everything in place. You can insert it almost like a tampon. So that's an option. And then strengthening the pelvic floor. It's you can do a lot with strengthening the muscles around that help support everything. And then you can also do a super lot with lifestyle, changing
Mhm.
the way you live your life. So managing your intra-abdominal pressure, figuring out, oh my gosh, I have a chronic cough because I'm a smoker, or I have allergies and maybe I don't take medication and maybe I need to start taking medication so I'm
Mhm.
not constantly coughing. Things like that, looking at how you're lifting things, looking at how you habitually stand and hold your posture, looking at how you work out, all of these things can contribute and add up throughout your day to a lot of downward pressure and a lot of strain on
Mhm.
these pelvic organs. And so sometimes just modifying your lifestyle and then doing some strengthening can help. And
Mhm.
if I can say one more thing about this, about the scar tissue that you mentioned with the adhesions,
Mhm.
is sometimes one thing that's contributing to the pelvic organ shift is scar tissue. And so I do have a little model here. This shows kind of very basic, can show how everything in our body is connected.
Mhm.
And the fascia surrounds everything. And sometimes, so if we think of, like, for example, let's say these are our sitting bones in our pelvis, the bony pelvis, these are our sitting bones. And let's say this is the uterus or the bladder.
Mhm.
Okay, so we're just showing that these sticks are more like the muscles and the organs and the bones, and these rubbery things are like the connective tissues, the ligaments, the fascia, etc. So if you have an adhesion, some scar tissue in some of the fascia, look
Mhm.
what happens to the organ. See how it shifts down?
Yeah.
Does that make sense? So
Yeah,
if
very
you
much.
release that scar tissue, it can actually help the organ move back into place.
Mhm.
So working with the soft tissue can be extremely helpful too, through scar tissue release, stretching, etc. So
Okay.
yeah.